Hi Logan, how are you today?
Hi, if I can be honest, I'm a little bit nervous.
Don't worry, we're just going to be going over your medical, dental, and health history. What are you nervous about?
I had a bad experience in the dental office as a child.
Could you tell me about this experience?
Sure, it happened when I was 10 years old. I was at recess and fell and hit my tooth on the sidewalk, and then I had to go to the dentist to get that fractured tooth repaired.
Oh, I understand why this could be a little bit difficult for you. What would you say makes you the most nervous?
Thinking about my appointment the day before, or when I'm in the reception area waiting for my appointment. Also, I get really anxious when I know I have like a big procedure happening that day.
Well, you're in good hands and there's nothing to worry about. I'm just going to be asking you a few questions about your dental history. So, was the last time you were in for an appointment for this fractured tooth to be repaired?
No, despite my anxieties, I come back for all of my recall appointments.
Okay, and what would you say your primary reason for seeking dental care is?
Definitely keeping up with routine cleanings.
It is very important to be keeping up with your appointments, so that's good. I also see here you're currently being treated for a medical condition and seeing a specialist.
Yes, I have tonic-clonic seizures.
Okay. And you're currently taking medication for this?
I am. I'm on Dilantin.
Okay. And how often do you take this medication?
I take it 3 to 4 times a day.
And that's exactly as prescribed?
Yes.
Okay. So when were you diagnosed with this condition?
I was diagnosed at the age of 7, so I've had quite a few years to notice my signs and symptoms before an episode happens.
So that's good that you're keeping on top of your condition. Has there ever been any serious incidents during dental treatment at all?
No. Like I said, I try my best to stay on top of my medication, so things like that don't really happen.
And before you were prescribed with this medication, was it very serious?
Yes, I had seizures quite frequently, but ever since I started taking Dilantin, the seizures are very minimal now.
Okay, so the medication has been working?
Yes.
Okay. And I know some of the symptoms can include just feeling a little dizzy or lightheaded, confused, headaches. So if you ever feel any of these symptoms, be sure to let me know.
Okay, I will.
And I know a side effect of this medication could be anticipated bleeding. And it says here that you have been advised to take antibiotics prior to treatment. Do you usually get pre-medicated with prophylaxis?
Yes, just because the bleeding often is quite bad.
Okay. And I also understand it's not recommended to consume very much alcohol while you're on this medication.
Right, I stay away from alcohol completely.
Okay. And I also see you're taking another medication related to anxiety and depression. So how are you handling this?
Good. It's called Elavil. I take it once daily. It just helps keep me more calm.
Okay, so you took your Elavil before this appointment?
I did, just because environments like this tend to trigger my anxiety.
Okay. And I also noticed that your blood pressure is slightly raised. It's in the pre-hypertension range.
Okay, that could be because I am nervous to be here. It usually is a higher reading when I'm in healthcare facilities.
Okay, that does make sense. I might recommend you to see a physician just because hypertension is very serious and it's better to catch it before sooner than later.
Okay, I'll definitely consider it.
Okay. And when you came in, I also noticed you had a slight bump under your ear. Do you know the cause of this?
I do. My friends and I were playing soccer the other day and the ball came up and I got hit in the face with it.
Oh, okay. I'll definitely note that, and we'll just check before at your next appointment just to make sure that the swelling has gone down.
Okay.
And it says here that you have had difficulty swallowing. Is there a cause of this?
Nothing unusual. I'm just getting over strep throat, so my tonsils are still a bit swollen.
Okay.
Yeah.
Is there any other concerns you have?
The other day when I was flossing, I noticed the floss kept getting stuck by one of my top molars. And then I went to go look and see what it was, and it was like a little silver piece hanging off of my tooth.
Okay, that sounds like it might be your amalgam restoration. It's just you're filling up on your tooth. I'll check it when I'm doing my cleaning, and I'll advise the dentist just to take a look at it because we don't want any plaque or bacteria or food to accumulate around that.
Okay, yeah, it's kind of been bothering me, so it'd be nice to get that looked at.
Okay, yeah. So you've asked very good questions. Do you have any other questions for me?
No, you've answered all my questions.
Okay. I think I have everything I need to know to continue with this treatment. Is that okay with you?
Yeah, I'm still a bit nervous, but I'm here and I'm ready.
Okay. There's nothing to worry about. Everything will be just fine, and I'm glad we covered everything.